Today we are looking at mental illness from GNC or NMCZ past paper 2019. So mental illness is defined as what we should know that mental illness is also referred to as mental health disorder or a psychiatric disorder. It is a medical condition that affects a person's thoughts, emotion, behavior, or a combination of these, often causing distress, impairment in daily functioning, and a decreased quality of life. So that is what we call a mental illness. Is it clear? Okay, so we should note that this condition can vary in severity and encompasses a wide range of disorders such as depression, anxiety, schizophrenia, bipolar disorder, and more, each with its own specific symptoms and characteristics. So, treatment and support for mental illness can include therapy, medication, and lifestyle changes to help individuals manage their symptoms and improve their well-being. So that is what you should know about mental illness. Is it clear? So it is a group of mental disorders. So it can be any disorder that causes uh, impairment to the normal functioning of a human being. Is it clear? Okay, let's now look at the predisposing factors of mental illness. So, number one, we're saying biological factor. So, genetic and family history can play a significant role in the development of mental illness in an individual. Is it clear? So, certain genes may increase susceptibility to disorder, though they are not the sole cause. So, sometimes the genes are not the cause, but it is believed that mental illness runs in families. Is it okay? Then the other one, we're saying brain chemistry, imbalance in neurotransmitters. The brain chemical messengers can lead to mood and mental health disorders. For example, low level of serotonin are associated with depression and high level of serotonin are associated with mania. Is it clear? We're saying the other causes of mental illness, we're saying trauma and stress. So, exposure to traumatic events or chronic stress can trigger or exacerbate mental illness issues. So, these include experiences like abuse, accident, or the loss of a loved one. So, that can put one to have mental illness. Then the other one, we are saying environmental factor. Living in a stressful or unhealthy environment such as high crime neighborhood or an supportive family can contribute to a mental health problem. Is it clear? Okay, so the other predisposing factors we're saying substance abuse. The misuse of drug or alcohol can lead to mental illness or worsens existing conditions. So substance abuse can disrupt brain chemistry and impairs judgment. Is it okay? So substance abuse is also bad. It contributes to mental illness. So those who misuse drugs or alcohol, they are at risk of having mental illness. Then the other one, we're saying physical health issues. So chronic physical illnesses such as diabetes or chronic pain can be linked to mental health problem. So the physical and emotional aspect often interact. Is it clear? So those are some of the predisposing factors of mental illness. Okay, so the other predisposing factors we're saying developmental factors, childhood experiences such as neglect or abuse can have a lasting impact on mental health. So early intervention and support are crucial. So developmental factors are also the contributing factors to mental illness. Then the other one we're saying social isolation. So lack of social support and meaningful connection with others can lead to feeling of loneliness. Yeah, and depression. So potentially contributing to mental illness. So it is important to note that mental illness often results from a combination of these factors, and each individual experience is unique. I repeat that each individual's experience is unique. So early recognition, proper diagnosis, and appropriate treatment are essential for managing mental health condition effectively. Is it clear? So those are the predisposing factors or the contributing factors to mental illness. We said biological factor, brain chemistry, trauma and stress, then environmental factors, substance abuse or misuse, then physical health issues, developmental factors, social isolation, etc., etc. So those are the predisposing factors of mental illness. Is it clear? Okay, so question C told us to describe the signs and symptoms of mental illness, isn't it? It told us to describe. So let's now describe the signs and symptoms. So what you should know that you can put any um, signs and symptoms. It can be either for mania, depression, schizophrenia. You can put any of the signs and symptoms since it's mental illness as a whole. So we are not being limited to which condition we should talk about. Is it okay? So number one, we are talking about persistent sadness or mood changes. So one of the hallmark signs of mental illness, particularly depression, is persistent and overwhelming feeling of sadness, hopelessness, or despair. There is also mood swings, irritability, or a sudden change in behavior can also indicate mental health issues. Then social withdrawal. Individuals with mental illness may withdraw from the social activities, isolate themselves from friends and families, and have difficult maintaining relationship. Okay, then a noticeable decrease in interest in previous enjoyed activities can also be a sign. So this is more to a patient with depression. Is it okay? Those are the first two signs and symptoms that one with mental um, illness will present with. Is it clear? So the other signs and symptoms, we are saying changes in sleep pattern. So insomnia or oversleeping can be symptoms of various mental health disorder. Anxiety, for example, may lead to racing thoughts and difficult sleeping, while depletion can result in excessive daytime sleepiness. Is it okay? Then the other one, we're saying change in appetite and weight. Significant changes in appetite and weight, either an increase or decrease, can be linked to mental health condition like depression or eating disorder. Some individual may use food as a coping mechanism, leading to overeating or undereating. So those are the some of the signs and symptoms under change in appetite and weight. Is it clear? So I have described the signs and symptoms, and you are going to get the percent for this question if you write like that. Is it okay? Okay. So the other sign and symptom we're saying difficult concentrating and making decision. So impaired cognitive functioning is common in many mental illnesses. People may have trouble concentrating, making decisions, or remembering things. These symptoms can interfere with work or school performance and daily activities, in short. So it is essential to remember that these signs and symptoms can vary depending on the specific mental health disorder and the individual. Additionally, not everyone with mental illness will exacerbate all of these signs. If you or someone you know is experiencing these symptoms persistently and it's affecting daily life, seeking professional help life, seeking professional help from a mental health provider is advisable. So early intervention and support can significantly improve the prognosis for individual with mental health condition. Is it okay? So those are the signs and symptoms one with mental illness will present with. Is it clear? Okay, let's now talk about the roles of the nurse to end stigma in the community. So nurses can play a crucial role in reducing the stigma associated with mental illness in the community. Here are some measures that they can put in place. So number one, we're saying education and awareness campaigns. So organize community workshops, seminars, or information session to educate the public about mental health, the common disorders, and the importance of seeking help. Share success stories and personal experience to humanize mental health issues and reduce stereotypes. Is it clear? So that is on education and awareness campaign. So the other role as a nurse is to promote open communication. So encourage open and non-judgmental discussion about mental health within the community. Then create safe spaces where people can share their concerns and experiences. Then address misconception and provide accurate information to dispel myths. Then the other one is to collaborate with schools. Work with local schools to implement mental health education program for students, teachers, and parents. So early education can help reduce stigma in the younger generation. Then you also identify and support students who may be experiencing mental health challenges. Is it okay? Okay, so the other one we're saying engage community leaders. So collaborate with community leaders, religious figures, and local influencers to advocate for mental health awareness and challenge stigma. So encourage them to speak openly about mental health to set an example. Then support group. Establish or facilitate support groups for individuals living with mental health condition and their families. So this group provide a sense of belonging and reduce isolation. Then offer resources and information on assessing mental health services. Is it okay? Okay, so the other thing that we're going to look at is promote accessible service. Advocate for improved access to mental health service within the community. This include increasing the availability of affordable and accurate sensible mental health care. Help individuals negotiate with the healthcare system and connect them with appropriate services. Then the other one, lead by example. Nurses can be role model by demonstrating empathy, respect, and non-discriminatory behavior towards individuals with mental health conditions. Show compassion and provide holistic care to patients, addressing both their physical and mental well-being. I think this is very much clear and straightforward. No more qualification that you need. So the other role of a nurse is challenge stigmatizing language and behavior. Speak out against stigmatizing language and behavior when encountered within the healthcare setting or the community. Then encourage colleagues and community members to do the same. Then advocate for policy change. Collaborate with local policymakers and organizations to advocate for policies that promote mental health awareness, reduce stigma, and allocate resources to mental health services. Is it clear, students? I hope this information is very much helpful to you. So, you should note that Reducing stigma around mental health is an ongoing effort that requires the involvement of healthcare professionals, community leaders, and the public. Nurses, with their expertise and trusted position in healthcare, can make a significant impact on changing attitude and improving the well-being of those affected by mental health illness in their communities. So it is very much key for a nurse to be involved in this end stigma to mental health, to mental illness. Is it clear? So that is what we are looking at: mental illness in mental health. Is it clear? Any questions? If there are any questions, please, you are free to ask.